Before we get started, my name is Bridget Vincent. I'm with Econometrica, and I'll be your host and moderator today. We'll have a few housekeeping items. We'll do a little bit of setup in terms of how to use your phones to interact with the content today. I'll do some introductions of presenters, and then we'll be on our way. So first of all, for those who have joined here in person, you should have received a packet when you joined this morning. The packet has a lot of the resources for the materials that you'll be using today and tomorrow, so don't lose your packet. On the left-hand side, you'll find an agenda and a full biography of each of the presenters over the 2-day period of time. On the right-hand side, you'll find an action plan for documenting some of the items that you think you might want to take back to your facilities to operationalize what you've learned today. We're also going to have an opportunity tomorrow morning for you to share some of your action plan items, but also share with each other some of the best practices that you've come up with in terms of implementing the OASIS D. There is also an acronym list, so if we're speaking in jargon and you need to refer to that acronym list, it's there for you. There are practice coding sheets for day 1 and day 2, and these are going to be the same sort of questions that come up periodically that we're going to ask you to interact with. When you're interacting with those questions, sometimes the question goes away or the scenario goes away, so you can use those practice coding sheets to refer to what the original scenario was that we're asking you to practice coding. You'll also find a worksheet for completing a scavenger hunt during our resources presentation, and then there are a number of documents for completing a reports activity for the last presentation of today. There's also a copy of the Section GG decision tree. That's a resource that many of you have asked for in the past. And then you'll find, lastly, the case study and case study narrative, the narrative and coding sheet, and that's really where we bring it all together at the end and ask you to look at a real-life scenario and then practice applying coding to a number of items across sections. These same resources are available online, so if you are connecting to this presentation today online, I would direct you to the Home Health Quality Reporting Program Training webpage. And on that page in the Downloads section, you'll find 5 folders. They're labeled March 2019 Home Health QRP Provider Training, Day 1 and there are parts 1 through 3, and then day 2, and there are parts 1 and 2. So day 1, part 1 contains the materials for this presentation, the Meaningful Measures presentation, and the overview of the OASIS Changes presentation. The part 1, day 2 folder contains the materials for the Section J and Changes in Skin Integrity M1311 presentations. And then the third folder for day 1 contains the material for the resources presentation and the reports presentation. Then the 2 folders for day 2, the part 1 contains the materials for the Welcome Day 2 and the Section GG presentation. And then that also includes the Section GG decision tree. And then the day 2, part 2 folder contains the materials for the drug regimen review and case study presentations. Finally, last housekeeping item, I believe, is for those of you who are joining us physically today, please feel free as you need to get up and stand up, or if you need to leave to use the restrooms. Restrooms are located outside the doors and immediately to the left. And any one of us in a yellow shirt is more than happy to help you, so please feel free to flag us down. So moving on, I'm going to quickly review the agenda. Again, today we're going to be going over the Meaningful Measures presentation, an overview of the changes to the OASIS D, or the OASIS D changes from the C2 version of the OASIS, the Section J health conditions presentation, changes in skin integrity, post-acute care pressure ulcer injury, the home health quality reporting program resources. So we'll actually take you on a tour of the home health quality reporting program website and help you become familiar with the great resources that are available to you there. Then we'll do a questions and answer wrap-up, and then we'll move into the We Want to Hear From You session. And in the We Want to Hear From You session, we're actually going to have the online participants participate as well. So we'll be having discussion here in the room. That discussion will be available to those online, and we'll give you directions in terms of how you can submit your ideas if you have ideas that you'd like to share with CMS during that session. Then following the We Want to Hear From You session, there will be an optional interactive session on the Home Health Quality Reporting Program reports. And we really encourage you to stay for this presentation. It really will, in a meaningful way, help you to understand how you can use these reports actually to drive quality improvement within your facilities. And we have a practice scenario with fictitious reports so that you can feel free to participate in that activity and hopefully then be able to apply that to your own facilities and agencies when you go back. So I am going to move on now and introduce today's presenters. Our first presenter is Dr. Rena Duzaja. We're honored to have her join us today. She is the Chief Medical Officer for the Quality Measurement and Value-Based Incentive Group in the Center for Clinical Standards and Quality at CMS. In this role, she oversees measurement development and analysis for a variety of CMS quality reporting and value-based purchasing programs. Dr. Duzaja is also an emergency medicine physician, and prior to coming to CMS was an associate professor in the Department of Emergency Medicine at the University of San Francisco. Our next presenter will be Kathy Roby. Kathy is a senior consultant for home health care at Qualidine. She specializes in teaching and educating nurses, focusing on improving home health provider clinical outcomes and reducing acute care hospitalization for Connecticut home care providers. Prior to her current position, Kathy was the Director of Compliance and Reimbursement at New England Home Care. She is an active member of the Connecticut Association for Home Care and Hospice, where she has served as President, Government Relations Committee Chair, and Board Member as a member of the Education Committee. Our two other presenters today are Charlotte Steninger and Ann Spinard. Charlotte is a consultant at Qualidine and has 20 years of professional experience in the home care industry as a nurse case manager, clinical educator, and consultant. Prior to coming to Qualidine, Charlotte served as the Director of Staff Development at Interim Healthcare of Hartford for more than 12 years. She is also an active member of the Connecticut Association for Healthcare at Home, serving on the Education Committee since 2013. Our last speaker today is Ann Spinard. Ann is a principal and vice president at Qualidine, chiefly responsible for program operations and overseeing major initiatives, including the Quality Innovation Network Quality Improvement Organization contract with CMS. Ann is also a master trainer for Team STEPS, an evidence-based teamwork program to improve patient safety, and helped adapt this national program for use in long care. Finally, Ann also serves on the Connecticut League of Nursing Board and the Avila Institute of Gerontology Board. And again, if you'd like full biographies, those are located either online in the welcome folder for Day 1, Part 1, or in your packets. So just a little general information. What we have posted currently are the presentations without answers. Following today's and tomorrow's training, we will post the materials with answers. Video recordings of today's presentations will be posted to the CMS YouTube site, And for those who are participating in person, we will also provide certificates of completion. We ourselves don't offer continuing education units, but often with the certificate of completion and the agenda, you can apply for those yourselves through your own professional organizations. So we're going to move on to a little bit of an icebreaker activity. So today's presentation, as I mentioned before, is interactive. You will all be using your phones to interact with the content in a variety of ways. There is the ability to connect to the internet here, so if you are interested, you can connect to the Lord Baltimore. I guess that's the name of the connection, and then the password is manager1928. So moving on to how we're going to use our phones. If you would open up, or laptop, if that's your preference, if you would open up your phone to your browser, and when you're in your browser or your laptop, if you would type in www.slido.com, and then you'll be asked to enter an event code, and you would just type in the word econometrica, and it's ECONOMETRICA. And again, we encourage the people who are online also to follow these same steps, because we'll be looking for your results coming in as well. So if people could give me a show of hands when they've got the browser open, they've connected to slido.com, and they've got econometrica typed in. Perfect. So the first functionality that we're going to go over is polling. So occasionally, as I mentioned, throughout today, we're going to be asking you to code a number of scenarios. We'll be asking you some other knowledge check questions, and that's when you're going to have the opportunity to respond. So we're going to go ahead and give it a try. Across the top, you'll see there are actually 3 different indicators. I think questions, ideas, and polls. You want to touch the poll or be on the poll piece of this presentation. And you'll see that pretty soon the question is going to come up on your phone. What famous jazz singer was born in Baltimore in 1915? Was it A, Billie Holiday, B, Herbie Hancock, C, Louis Armstrong, or D, Ella Fitzgerald? And I see a few people are responding. Right now it looks like we have a predominance of responses for Billie Holiday coming in. We've got a few responses for Louis Armstrong, followed by Ella Fitzgerald and Herbie Hancock. I see we still have responses coming in. Going to give it just another moment. Okay. I'm going to ask that we move on to the answer slide. So the answer is actually Billie Holiday. And I have a little fun fact about Billie Holiday here. One moment. Billie Holiday was born in Eleonora Fagan Gow, I think that's how you pronounce it, in 1929. Next question. Francis Scott Key wrote which of the following at the Battle of Baltimore in 1814? A, America the Beautiful, B, Your Grand Old Flag, C, The Star-Spangled Banner, or D, Take Me Out to the Ball Game? Well, it looks like a lot of people probably are thinking it's the Star-Spangled Banner. And my guess is that's probably the correct answer. So let's check. And it is the Star-Spangled Banner. So we're going to just try one more of these. And this question is, how did the city of Baltimore get its name? A, was it named after the founder of Maryland, Lord Baltimore? B, was it named after the Battle of Baltimore? C, was it named after a famous baseball team? Or D, was it named after the state bird, the Baltimore Oriole? And again, this looks like an incredibly smart audience. The predominant answer is A, it was named after the founder of Maryland, Lord Baltimore. Let's see if that's the correct answer. And the correct answer is that it was Lord Baltimore. So now we're going to try a little bit of a different type of question. And this question is a type in your own response. So Baltimore is well known among food-savvy travelers. What food comes to mind when you think of Baltimore? And as you're typing in your answers, I believe some of them will start to show up on our screen here. Oh, so I see there's a lot of seafood lovers, crab cakes, cookies. I think we're seeing mostly crab cakes, seafood, beer, okay? I'm from Portland, and I thought beer was Portland, but Old Bay seasoning, crackers. Okay, so we have a good number of responses coming in there. And, hold on to this thought, because later on, tomorrow, we're going to be asking you to do this under the Ideas tab. So now, we also want you to be able to submit questions to us. And so in order to do that, we need you to set up a quick profile. And the reason for that is sometimes we need to ask for clarification on questions, and so we need to know ideally who you are and how to get a hold of you. So if you'll notice in your phones and on the screen, there's a little avatar in the upper right-hand corner. It currently has a circle on it on the screen. If you would click on that particular avatar or little figurehead of a person, you'll go to a screen that looks similar to, it doesn't look quite similar to that yet, but basically you'll be asked to type in your name, your company, and your email address. And again, I encourage people online to do this as well, because we definitely want you to utilize this function throughout the day. Our presenters will be using their lunch hour and breaks to respond to these questions, and at the end of the day, when we have our Q&A session, we'll get to as many of those questions as we possibly can. So for the people in the room, if you let me know when you've got your profile set up, basically your name entered, again, your company and your email address. It should then take you back to the questions screen. And again, you want to be on the tab across the top that says questions. So once you've completed that tab, what we'd like you to do is, submit a question or two. So it could be any question, just a random question. What color is the sky, etc. And you'll see that your questions are coming in, and you can also see the questions that other people are asking. So one of the things that we're going to ask you to do today is when you get ready to type in a question, if you see a question that's already there, if you could vote for that question, that would be extremely helpful, because that will help our presenters prioritize which questions to answer first. We basically look at the questions that have the most responses first and then work our way down. And one thing, when you are entering your questions, if you wouldn't mind, it would be very helpful if you would enter both the section number and also the item number, if an item number is appropriate. Again, that will help us respond to questions more quickly and efficiently. Any questions about any of that I've covered so far? Okay. I'm going a little quickly, so yes, to set up a profile, let me go back. You can see right here up in the upper screen, there's a little head and shoulders. It's circled. If you click on that, It'll allow you to enter your name, your company, and your email address. Any other housekeeping question before I move on? Okay, we're now going to talk a little bit about sharing your action plan ideas. So as I mentioned earlier, we encourage you to use this form that's actually located at the very top of the right-hand side of your folder. It looks like this. There's a different page for each section. And what we encourage you to do as you're listening to the presentations is write down any actionable item or item that comes to mind that when you go back to your facilities, you think will be important in order to operationalize what you've learned. So it could be that you're thinking, oh my gosh, in order to operationalize this, I need to look at a policy or a process, or we use an electronic health record. I need to make sure that the data is actually collected in that health record, or that there's a segment of the employees that you work with that might need to be trained. We encourage you to jot down those ideas. Also, since you've already implemented the OASIS D in hopefully all cases, if you have a best practice that you used at your facility that you think you might want to share tomorrow morning with your colleagues, write that down too. Because tomorrow morning we're going to come together and have a discussion, and then people in the room will have a tabletop activity. People who are online will actually be submitting their ideas electronically, and then we'll have a debrief. So that's a really good opportunity or way for you to learn from each other. I think that is most of what I need to cover today. I'm running a little bit ahead of time, but we do have a wonderful presenter, Dr. Duzasia. And if she could make her way to the front, I think we'll go directly into her presentation so that we give her lots of opportunity to share with us. And thank you again for being here, whether you're in person or online. And if you are participating online, you'll find Dr. Tuzasia's full presentation in the first folder.